I'm Jennifer. I'll be doing an assessment today of the skin, hair, and nails. And I'll also be assessing the eyes, the ears, the nose, the mouth, and the throat. Alright, hello. My name is Jennifer.
Hello.
How are you doing today? Good. So today I'll be taking an assessment of you today, just of your skin. Well, we'll start off first with your skin and your hair and your nails. Alright? So first I would like to assess the skin. The skin is nice and tan, like a light tan brown, normal for ethnicity. There is the skin is nice and warm, bilaterally upper and lower. The skin is dry on the lower extremities. There's no lesions noted, although there are some freckles, some small brown melanin, deep melanin freckles noted along the cheeks. Alright. So now we're also going to look at the hair. The hair is nice and soft. It is dry. There is some male pattern baldness noted. Are you aware of that?
Yeah.
Okay. Does it run in your family?
No.
No, it's pretty common. Alright. So next, there's no bumps or swelling noted at this time on the head. I'm also going to take a look at the hair. The facial hair is nice and evenly distributed along the face. There is no folliculitis notice. Do you shave?
No.
No, he doesn't shave. You use a razor or you clippers on a barber? Okay. So there is no folliculitis noted at this time. So next we're going to take a look at the nails. The nails are nice and healthy. They're nice and smooth. The nail bed is nice and pink. The capillary refill is less than 3 seconds. Could you place your hands like this for me? Alright. The degree of the nails are at 160 degrees. There's no clubbing noted at this time. You can relax your hands. The next thing we'll move on to is the eyes. So with the eyes, they look a little red tonight. Do you have any allergies? Are you tired?
A little tired. No allergies.
No allergies. This is normal for you?
Something.
Okay. Alright, so the hair is evenly distributed on the eyebrows. Alright, so the eyes are nice and brown. The pupils. I'm just going to take a look into your eyes. The pupils are nice and round, and they're equal to light. I'm going to take this pen. I'm going to ask you to look over my shoulder, and we're going to check cranial nerves number 3, 4, and number 6, which are your oculomotor, your trochlear, and abducens. And we're checking for the oculomotor movements of the eyes. So I want you to take a look over my shoulder and look straight for me. And I want you to follow my pen, okay? Excellent. The cranial nerves are intact. Next, with the eyes, we would typically do a Snellen chart to test for your vision. Do you wear any glasses?
No.
No? Okay. Well, we don't. I do want to check for the configuration test, which I'll ask you to close one of your eyes with your hands, and this is testing the peripheral fields. Your hands over your left eye. All right. And my fingers. Good. Let's try the other hand. Great. Going so far?
Good.
Good. All right, so the next thing, I'm just going to take a look into the eyes. I'm going to put I want you to look up, and I'm going to look into the conjunctivae and sclera just to take a look, all right? They're nice and pink and moist. No evidence of any lesions noted at this time. You okay? Okay. All right. The next thing we'll look at is we'll take a look into the nose. So first we want to check it's nice and distributed evenly with the face and midline of the facial features, with the rest of the facial features. There's no macula or lesions noted. I'm just going to take a look into the nostrils. There's no drainage present. And it's nice and red. There's no inflammation noted at this time into the nasal passages. I'm going to have you, I'm going to test your cranial nerve number. Let me see, the smell is olfactory. So I want you to close your eyes. Close your eyes and close one of your nostrils. Can you smell this for me? Okay. All right, occlude the other one. All right. So that was testing your olfactory, cranial nerve number 1. All right. So the next thing I want to check for is the ears. The ears are nice and evenly distributed as well, both bilaterally on each side of the head. The pinna lines up with the cornea evenly. So right now I'm going to take a look into the ear. I'm looking into, I'm looking for any type of drainage. I'm looking at the tympanic membrane to make sure no infection is present. All right. So the tympanic is a nice shiny gray color, no drainage or fluid that was noted, it's not red. Do you have any ear aches recently? No? Okay. So your ear, I would do the same for the other side. I'm also right now going to do the whisper test, and that's checking for cranial nerve number 8. So I'm going to whisper 3 things, and I want you to read it. I want you to say it back to me, okay? Good job. So the next thing that I want to do is I'm going to check for the sensory functions of the face, and that's the cranial nerve number 5, the trigeminal. So at this time I'm going to have you just close your eyes, and as soon as you feel something, I want you to say now. All right? Excellent. All right. So right now I'm going to check the sinuses. I'm going to take my 2 thumbs and just press on the sinuses. I'm looking for any type of pain. Close your eyes. How was that?
Fine.
How about now?
Fine.
Okay. Pause it for me. All right. So we're moving on to the mouth. So right now I'm taking a look at the lips. They're pink. They're nice and moist. There's no cracks or no ulcers noted. I want you to say ah for me. And right now what I'm going to do is take a look. You can close your mouth for 1 second. Let me get my gloves on. This is my tongue depressor. Alright, so I would like you to say ah for me. Alright, the tonsils and the uvula and nice and in the midline, and it rises and fall. And that's testing the hypoglossal cranial nerve number 12. Also, that usually we check for the gag reflex as well. Excuse me. And it's present and intact. I want you to say ah for me one more time. Ah. So, right now, I'm taking a look at his teeth. They're nice and white. Gums are nice and pink. There is a cap noted at the second molar on the left side, and then 1 molar missing on the right side. Okay. You can close your mouth or keep it open. So lift your tongue up. Underneath is nice and vasculated, shiny and glossy and red. You can let that down and stick out your tongue. All right, the tongue is nice and midline, and that it doesn't deviate. That tests for cranial nerve, your glossopharyngeal. All right, go relax that. So we're going to do some facial exercises. Basically, I'm testing your cranial nerve number 7. And I'm going to ask you to smile for me. I want you to frown. I want you to puff out your cheeks. I want you to squint your eyes. All right, now have your face normal. All right, excellent. So cranial nerve number 7 is intact. There is no weakness noted at this time. Everything was lined up symmetrically. All right. So the next thing I want to look at or palpate is the lymph nodes. And the lymph nodes are usually we check for if they're raised or they are palpable, then it indicates to us that it may be an infection or something is going on, okay? All right? So I'm checking the pre auricular, post-auricular, occipital, retropharyngeal, the submental, super clavicle chain. Turn your head this way for me, in the deep clavicle chain. And then I want you to raise you can turn your hand and raise this. And then supraclavicle. Alright? No lymph nodes were palpable. You can relax. At this time, which is a good indication, no infection or no is going on at this time, no allergies at this time. Right now, I'm just going to take a look at the throat and the neck, and the trachea is in nice and aligned, midline of the neck. The thyroid is not noted upon inspection. So I'm going to palpate the thyroid and make sure there's not any nodules. You can relax. Alright, but I didn't ask you, could you swallow for me? Great. So I didn't notice any nodules upon palpation at this time. Have you had any thyroid issues in the past?
No.
Great. So this will conclude my assessment at this time of the skin, hair, nails, eyes, ears, nose, and throat. Oh, scan the room. Scan the room. Sorry. Thank you.